In this podcast episode, Dr. Gabor Maté delves into the intricate relationship between stress, trauma, and disease, emphasizing how our understanding of self and societal expectations shape our mental and physical health. He begins by addressing the pervasive feelings of resentment, alienation, and depression that many individuals experience, particularly in the context of parenting and societal pressures. Dr. Maté argues that the question, "Who are you?" is more significant than any answer we might provide, as it reflects our self-perception and influences our behavior and interactions. Dr. Maté posits that our identities are often confined to societal labels, such as being a doctor or a plumber, rather than encompassing the entirety of who we are. This narrow definition can limit our reactions and perceptions, leading to a disconnection from our true selves. He highlights the importance of being present and accepting oneself without the constraints of societal expectations. This perspective is crucial for understanding how we lose our sense of wholeness, a state that is natural to children but often eroded by external pressures and parental expectations. The conversation shifts to the complexities of modern parenting, where Dr. Maté reflects on how societal norms have distorted the nurturing of children. He references the work of Aboriginal tribal peoples, who parent in ways that foster a strong sense of self-worth and connection in their children. In contrast, contemporary parenting often involves projecting adult anxieties onto children, leading to a loss of their innate wholeness. Dr. Maté emphasizes that children need to be seen and accepted for who they are, rather than being molded to fit parental expectations. He notes that many parents, despite their best intentions, inadvertently send messages of inadequacy to their children by prioritizing work and societal success over emotional connection. This dynamic can lead to lifelong anxiety and a disconnection from one's true self. Dr. Maté underscores the need for a more communal approach to parenting, where support systems are in place to help parents nurture their children without the overwhelming pressures of modern life. Dr. Maté explains that stress is not merely a response to external pressures, but is deeply rooted in our early experiences and relationships. He discusses how the physiological and neurological wiring of children is designed for connection, and when that connection is disrupted, such as when parents are emotionally unavailable or overly critical, children develop anxiety and stress responses that can persist into adulthood. He highlights the concept of evaluation stress, where constant assessment in educational settings can lead to elevated stress hormone levels, further exacerbating mental health issues. The discussion also touches on the societal emphasis on individual achievement, which often comes at the expense of relational well-being. Dr. Maté argues that this focus on individualism creates a culture where people feel disconnected and undervalued, leading to a cycle of stress and trauma that manifests in various health issues. A significant portion of the conversation revolves around Dr. Maté's therapeutic approach, known as compassionate inquiry. This method encourages individuals to explore their beliefs and emotional responses to uncover the root causes of their distress. He outlines a series of questions designed to help people identify areas in their lives where they struggle to assert themselves, particularly in saying no to others. By examining the beliefs that underpin these struggles, individuals can begin to rewire their thought patterns and reclaim their sense of self. Dr. Maté emphasizes that recognizing these beliefs is the first step toward healing. He encourages listeners to engage in self-reflection and to understand that their current mindset is not fixed but can be transformed. This process of inquiry is not only about addressing personal issues, but also about fostering a deeper understanding of oneself in relation to the world. Throughout the discussion, Dr. Maté reiterates the idea that everyone is born whole and that this wholeness can be rediscovered. He challenges the notion that individuals are broken or irreparably damaged, asserting that as long as one possesses consciousness, there is potential for healing and growth. He encourages listeners to trust themselves and to seek their true calling, rather than conforming to external expectations. Dr. Maté's insights extend to the realm of self-esteem, where he distinguishes between contingent self-esteem, based on external validation, and genuine self-esteem, which is rooted in self-acceptance. He warns against the dangers of relying on external achievements for self-worth, as this can lead to a perpetual cycle of dissatisfaction and anxiety.